What if I don't know the answer? What if I make a mistake? What if I fail? These were just 3 of several questions that Dr. Stacy and I that were going through our heads. Unfortunately, she can't be here with me today because she is about to have a baby, my first nephew, which I'm so excited about. Coming up on graduation in dental school, you are frightened of, oh my gosh, I'm not going to have a faculty member there to check my work. What if I fumble and stumble in front of patients? And so Dr. Stacy and I were talking, and we were thinking, okay, well, where do we want to go? What do we want to do? Where do we want to work? And one thing that we did know for sure is that we wanted to work for either a company or someone that had the same values and principles and standard of care that we had envisioned once we graduated from dental school. My 4th-year partner, Dr. Andy Cupp, who works for Heartland, had given our names to recruiters, and we got a phone call, and we actually spoke with the lovely Miss Melissa Acevedo, and they presented us an opportunity to open up a brand new DeNovo. And Stacy and I are like, oh my gosh, this is like a dream. We didn't think we were gonna get to work together until 5-10 years down the road. So we're all excited, we're like, yes, and then we're thinking, oh my gosh, we are gonna have to be leaders of this practice. What does that mean? What does that look like? What does it mean to be a leader? So one thing that we decided to do is that we sat down and I said, Stacy, what do we want to be as leaders of this practice? And one thing that we definitely wanted to do is, obviously you set expectations for your staff in office, but communication was the biggest thing for us. Communication is big to us, not just in business, but in our personal lives. And communication being direct and having direct communication. And so that's the one thing that I have to say that I love about Heartland is the support and communication that you have with not just your RMO and your RDO, but all support staff of Heartland. And one thing that I would say the reason why our DeNovo office has been so successful is because Stacy and I have not been afraid to communicate what our wants, needs, fears are with our support team. And I have to say that we are very lucky in the fact that Deborah Bordenaro, who is our regional manager, and Melissa Acevedo, our RDO, has allowed us and made us comfortable with coming to them with concerns. And I think as a new grad, you are afraid to communicate those concerns because you don't want to seem like a failure or that you're weak or you don't know what you're doing. One thing that we did decide that it would be very important to take ownership of becoming the leader, and both of us doctors being on the same page. Now granted, we are twins, and so we kind of have the same mindset, but the one nice thing is that my weaknesses were her strengths and her strengths, or her weaknesses were my strengths. And so once we started our DeNovo, we set expectations and guidelines for our staff, but definitely making sure that we made them comfortable knowing that we want to be open with our communication and them to be able to come to us. And that's how Melissa and Deborah made us feel that, opening this new practice and taking on this new leadership role, it's scary, especially coming out as a new grad. Like I said, you don't have all the answers, and you're afraid, what if I do make a mistake, or what if I fail? And granted, in this past year, which we just celebrated our 1-year anniversary just last week, and we've had failures, we've had mistakes, we've had bumps in the road, but we were never afraid to communicate those fears or concerns with Deborah or Melissa or our team. And I think that's the most important thing as a new grad coming out is you can't be afraid to fail or afraid to communicate your wants and needs. Granted, you have to be tactful, as Ms. Deborah always says, be tactful, Dr. Sheena, but you can't be afraid to do that, because how are we supposed to learn and grow if we don't learn from our failures and discuss them with everyone? So one thing that we do have as a philosophy in our office is all of our patients in our office are not just some are mine or some are Dr. Stacy's. All of our patients are everyone in our office's patients. Now granted, we are a little lucky because we are twins and we do look a lot alike. So half the time when we go into the room, they don't know who is who. Although lately I've been getting a little offended because I'll walk into the room and they're like, oh, I thought you were Dr. Stacy. And I'm like, I take a little offense to that because I don't have a belly, but that's all right. We'll let that slide. So one thing that, coming up since we had our 1 year, Dr. Stacy and I were reflecting on the past year, and like I said, we've had several challenges with staff, patients, and all that stuff that everyone always continually has those challenges throughout their career. But one thing that we continue to talk about, Dr. Stacy and I, is that how communication is still going to be the most pivotal part of our practice, and not just communicating with our staff and then obviously our support team, but how we communicate with our patients. We coined the term of we want our office to be a well-oiled machine, because having a well-oiled machine, you can provide the best patient care. And so as a new grad, looking back on it, been out about 1.5 years, I have to say, being thrown into that leadership role, I was so scared and nervous, but being thrown into that, I don't think I would be the dentist that I am today if I didn't have the support, obviously from Dr. Stacy, which is very important, but from the support from Heartland, and then especially, I'm gonna keep giving kudos, but to Melissa and Deborah, because it's just been so pivotal and important to have that support team behind you, because it's scary coming out as a new grad, but taking on that leadership role, as I said, I think Dr. Stacy and I have become dentists that I honestly don't think in any other company, or even as an associate in a practice, we would be where we are today. So I guess that's the one thing for new grads when they're coming out is don't be afraid to take that leadership role, but communication is the most pivotal thing that you can take away and continue. We are always continually working on communication, but communicating directly and effectively and being tactful in your communication is the most important thing. And I have to say that is probably the reason why our practice has been so successful in this first year, is because we have not been afraid to communicate those concerns or failures with not just support, but like I said, our whole staff. Thank you.